Mentor Konnect, a new platform designed to accelerate your personal and professional development.
So Amit, welcome to this session of Mentor Connect. We are delighted that you could spend some time with us and share your experiences, and we're looking forward to having a conversation. So over to you.
Yeah. Thanks a lot, sir. Thanks to Virender, sir, also that we got connected via Charu, and we had the opportunity to discuss what I was doing, and I mean he felt that I could be of good use on this community and to share my experiences and work what I've been doing. So thank you for bringing me here. And I'd like to start. So my name is Amit. I'm Dr. Amit Sharma. Um, I did my bachelor's and master's from India. And after the master's, I worked as a junior research fellow at Indian Institute of Science, Bangalore. And that's when the time was that, interestingly, I never wanted to work on cancer, but destiny had its own plans. So I was interested in working on stem cells, and I wrote to few people in India. At that time, I think it was 2008. That's what I'm talking about. So I wrote to 5 or 6 people in India who were working on stem cells. Replied, and she was my supervisor at Indian Institute of Science. Her name is Annapurni Rangarajan. Maybe some of you know her. And she was working on cancer stem cells, not stem cells as per my interest. So I thought, okay, anyway, let's get started. And I joined. I wrote her an email that okay, I did my master's from MSU and I want to do fellowship and get some experience in the lab. And she promptly, like in an hour or so, she replied, come and join my lab. I said, okay, Jaipur to Bangalore, I had to go by train that time. And she didn't know me, she didn't ask CV or anything. She said, just come and join. I said, okay, sounds positive. So I just went, I took a train. That time flights were not so frequently running, and I think there was not any direct flight. So I took a train and went to IRC and met her, and she said, "Oh." And then I asked in the lab that why did she just ask me to join? She said her first PhD student was from MSU, and she really liked the students from there. So she just asked you to come and join, and I said, "Great." So yeah, I spent there 1 year or so, and then my interest and my I read a lot about cancer those days, and like it just opened a new view in my brain. Okay, this is something interesting, and I would love to work on that. So I was parallelly applying for PhDs. I went to Germany for my PhD, and again because of the interest in cancer field, so I joined the cancer lab. It was a blood cancer, acute myeloid leukemia lab. So I did my PhD there. I worked on 2 projects. One was drug screening to find inhibitors which could help in treating acute myeloid leukemia. And the other one was like kind of, you can say, immune function study to treat acute myeloid leukemia. So we found 2 of the genes again through a screening, which if you overexpress in acute myeloid leukemia mouse model, you could actually get rid of blood cancer in those mouse models. So these were the 2 topics which I worked on during my PhD. After that, I stayed in the same lab for my postdoc. I had a good connect with the boss there, and he said, "Why are you moving? Just stay here and continue." And then I worked on CRISPR engineering to knock out few genes, and primarily the MN1 gene, which was like the gene of the lab as such in mouse models with acute myeloid leukemia. And so we knocked out that via viral vectors and all. We also did nanoparticle-mediated knockout. So what we did is we introduced a protein and shRNA via packaged nanoparticles. So we had a nanoassembler in the lab, and we used to get lipids from the company, and we used to package at home, kind of. So nothing was outsourced. We used to make nanoparticles with siRNA, shRNA. And we also, like one of my paper is also like we had BCR-ABL siRNA. It's translocation which is in CML model, chronic myeloid leukemia model, and we could completely treat the mice if you just inhibit the translocation. So yeah, these are my experiences during the PhD and postdoc. And after that, yeah, I was little bored with research, or not so excited anymore. And so I took a 6 months break, and I came to India. It was in 2019, and COVID happened. So my 6 months became like 1.5 years kind of here in India. But I enjoyed that time to be at home after a long time, and that's when I met some cancer patients here in. I'm speaking from Jaipur right now. That's my hometown. So I met some cancer patients through a friend, and they had a lot of questions about cancer. Okay, why did it happen to me? What was wrong? Is it all genetic or it's environmental? Will be passed on to the children? Like that. And what can I do with my food choices or lifestyle choices, etc. And I said, yeah, I mean, this is like because as a scientist, we don't have a chance to talk to people. We just stay in the lab, we read our papers, and we write papers, and we don't communicate with the society as such. That okay, why is it happening? What is the cause? What can you do? Something like those. And also the doctors, to be honest, they don't have more than 10 minutes for a patient. I mean, let's be honest, if you're an oncologist in a good city, tier one, tier two city, then you can't give half an hour to a patient and answer their questions somehow. So I felt that this is I mean, I got very much attracted to this thing, and then I started working just without a name or something, whoever could connect me to a patient or so. And then I started this, and in 1 or 2 years, after 1 year, as I said, I went back to Germany. And then, so the life took a different turn. I found a consulting job in a pharma company. It was like in the production, IT, and also cell and gene therapy. So I was helping multinational companies through that Kerber, that was the name of the company, through them. And we were connected through many companies, and I used to give my consulting expertise to them. And then so 9 to 5, I was working on that. And after 5 p.m., I used to do my this cancer consulting work. And until 2024, I did that. And I was doing it for free of cost. Like I was not charging anyone. And normally the session would last like 1 hour until, so I used to say that until your questions are finished, I'll keep answering your questions of the patient and their loved ones, I think. So yeah, that's what I love doing. And then in 2024, I was again like little on the crossroads that okay, should I follow the heart or follow the money or the job what you are doing. So then I said, okay, let's take a break and move back to India and completely focus on this work what I'm doing. So I came back here, and then I started like 100% on this work, and we monetized it also because there was some reasons to do that. One of the reason is that when you advise people for free, they don't take it seriously. I mean, they will listen, they will talk to you for 1 hour or so, but they will say, yeah, we will do it, but they will not do it. So that was the reason, and also like I had no other earning source here, so we monetized it, but it is still free for people who cannot afford it. So we are very clear on that. That if I know that the person's economic condition is not good, we do it for free. So there is no ifs and buts there. And so this is what I've been doing. And during, just to briefly mention that since 2019, I'm doing this. And in between around 2020 and 2021, I thought there is a lot of psychological strength needed to fight cancer. I mean, of course, you need bodily strength and mental, and of course, economically, you have to be sound. But sometimes people break down mentally before even breaking down physically. That once they hear, कि, okay, patient जाता है doctor के पास कि okay, you have cancer, and suddenly you are hit, and you are thinking, okay, what will happen to my children or my wife or my parents, or if somebody is elder, then they will think, okay, what did I do wrong? I didn't smoke, I didn't do anything, but why? Kyun aaya ye? Kind of those questions. So I thought so I did an additional master's degree in psychology after I mean, in 2021 to 2023 from Germany only. And last year, I also did one course which is specifically for cancer patients. It's through Harvard Medical School. So there is a psychosocial counseling course for cancer patients. So I did that also, and it really, so I'm also helping like counseling for general issues. So I'm like now, right now, we are running two things in parallel. One is the cancer consulting thing for the patients, and the other is like the mental health or mental well-being for people. So these are the two core things which I'm doing currently. And I would be happy if there are any questions or what are your thoughts about it. I would love to hear back.
Yeah, thank you. What an inspirational story, Amit. This is amazing. I mean, going from basic science to completely diving into patient, what would you call it? Patient advocacy? What would you call it?
I would say it's a consulting because I think advocacy is a US kind of a word probably. But I would
Okay.
say here in India and Europe, for the patients what I'm consulting, I think it's consulting is a better or a, like I would rather termed it myself as a cancer health advisor.
Hmm.
Right. So
And
that's what.
how, and I'll let folks ask questions, think about questions, but how
Mhm.
does do you also advise on, let's say, genomic analysis? Somebody does that genomic analysis, and then you can suggest which drugs to take, or is that too clinical?
Not exactly, sir, because that comes when then you are in a like a conflict with the doctor.
Yes.
So I only when I see the prescription and I talk to the patient, I only go against the doctor when it's really like black and white. When I see that the maybe the doctor is treating for profit making or so, but that happens like I would say 1 in 50 cases or so.
I see.
Otherwise, most times I think it's in line with the doctor. But yeah, you are right that we do also advise genetic tests and all. And also, like when, as I said, that some people they come with that, okay, is it inheritable to my children? And some of the cancers are. So then we advise them that the children, the daughter, in case of breast cancer and prostate cancer for boys. So then we advise them to take the test and then tell them, okay, this is how it works. So in that sense.
Okay. Maybe other folks can ask questions.
Thanks, Amit. I think like I already knew your story, so you have, I think, taken decisions so many times, right? So every time like there is something, it might be looking like you are confused, but same thing, like happens to PhD postdocs, so like this
True.
uh, depression, stress, or
Hmm.
actually psychological issues, right? So
True.
I
True.
think, will you be willing to spread it to maybe broader audience, right? Beyond the hospital you are associated with?
Sure. Sure. Yeah. Yeah. Sure, sir. And also, interestingly, okay, one thing I think I mentioned it to you when we were talking. So, in last 9 months or so, when I'm doing the counseling for general patients, not only cancer patients, I found that, which is surprising and alarming, that 90% of the cases are below 35 years of age. And if you even cut down, probably 95% of the cases are below 27 years of age. The youngsters, they are reaching out, okay, we have this problem, we have relationship issues, this is not working, my exams are, I'm not focusing on very general issues and all. And you just have to be like a elder coach or something, life coach, or just have to give them a better direction also. And sometimes there are some serious topics also. But yeah, most times you can help out, and I think mentoring them that okay, this is normal, this is life experiences and all. So I think that is very. I mean, to me, it was surprising that okay, so many young, and it's also brave of them that they're coming out and speaking about it and discussing with someone rather than taking like adverse steps or something.
Okay, so maybe I'll ask the question to you. Now coming back to India, you came back in 2019, stayed for a year and a half, and now you come
Yeah,
back now. Have you seen any changes in India itself from 2019 to
a
25,
lot,
25, and what?
a lot, sir. India has changed. I think when I came in 2019, I used to think Germany is more developed. But then I think after staying here for 1 or 2 years, and I kept coming between these 2019 and 2024 quite often actually. So like 2 or 3 times a year, in a year. And I really found that India has changed dramatically. So India is progressing. And when I used to go back to Germany, it felt like Germany is going like the opposite direction and India is going in the opposite direction, like technical and IT wise, or this Uber, Ola, whatever, and you just everything is on the hands. You just have to make payments or find a taxi or anything. But when you used to go to Germany, it felt like जैसे कोई वो बैलगाड़ी वाली जगह पे आ गए kind of. Oh, okay, we have to wait. Oh, okay. So I think that is for sure. I mean, I am feeling a lot of changes here, and in the positive way.
Yeah. How about work related? And not just 2019 and 2024, but how is work related things different or similar?
Work related, I would say, I mean, the at least the patient related queries and all, they are almost the same. But one thing which I've noticed is because of this change in the social media and YouTube, and there are a lot of different people who are giving gyan or knowledge about cancer on Instagram and YouTube and all. That is little sad sometimes to see, because they are not. I mean, sometimes they are वो झूठा ज्ञान, basically fake knowledge को expand कर रहे हैं just to get attention. And
Yeah.
people should reach out to them, and they just hook upon that, because there are a lot of Ayurvedic people and all who are saying we will cure this, हम pancreatic cancer को cure कर देंगे. But I mean, people are just preyed upon, kind of. They just want their money, and then after a few months, I see a lot of cases every day in this manner, that they will come to me. Okay, I mean, I'm not saying I'm against natural medicine or anything. I'm saying there's a balance of both the things. Even if you want to take the medicine, there's a time that you focus on those things. But if you want to go to natural thing, once the treatment is over, you can start the lifestyle changes. And Ayurvedic also, I'm not against anything, but there is a sectorial time to do things. You can't just mix up everything and mess up everything or something like that. Because I've seen results don't come like that. And also don't, like, people are more, of course, they are more inclined towards social media experts and all. But most times they are making the claim on a very like catchy sentences, or to attract their attention or something like that. So I think that is a little sad to see actually.
Hmm. Yogita has a question. I don't know, Yogita, should I just read it, or do you want to ask it yourself? So Yogita asks, it is inspiring to learn about the selfless service and coaching that you're doing. Coaching is very important to save lives from mental stress. What is in your opinion about life coaches who take heavy amount of life coaches? I guess, Yogita, is it related to? Is this a lot of work? Like, is that how you interpret it? I mean, Yogita,
I
is that
think
correct?
I think probably what she means is, because I have some patients, they tell me that we went to this life coach and they charge a lot of money. I think
Yeah.
it's about money, probably what she
Okay.
wants
Okay.
to
Okay.
say. So I think,
She
yeah,
says charge.
to everyone charge, basically. Yeah, I know they charge a lot, and they would just be there for 5 or 10 minutes probably. So which is like, it's like nothing. And people have to open up. You can't just open up to a stranger. Okay, ye problem hai, and solve it. You can't do it in 5 10 minutes. I mean, I've been mentoring, or I've been help counseling youngsters these days since past year or so. So it needs like at least 3 or 4 sessions to bring them to normal, or speak out, or first is the acceptance. Let them speak, and then acceptance of the problem what they have. You can't do it just do it in 5 10 minutes. But again, it's like the times are changing, so people are going for those things.
Yeah. I'll just
Okay,
pause to see.
I have a
Yeah, Shruti.
question.
Yes.
For example, if suppose I am a cancer patient and I'm just saying I don't know what happened to me, why I'm
Mhm.
going through this. So how do you counsel? Like, is it I would like to know the approach on, how do you advise? Like, is it science backed or what is the approach? Like, how do you
Yeah.
uh, talk to me? Like, just I wanted to know
Mhm.
in general.
So that's a good question. So what we do is we take a lot of background first, Shruti. So
Mm-hmm.
what were you doing? What's your age? What's your life been? I mean, do you smoke or not? Do you drink? Do you drink or not? I mean, these kind of questions in a detailed way. And you know that what we also talk about, does anyone in the family before they had cancer? Because it can be genetically inheritable also. So these first we ask these questions, and then accordingly we counsel them or we talk to them. Okay, this might be the reason why this has happened. And at times, some people would say, okay, I didn't smoke, I didn't do, I have stayed in a village all my life, and having fresh air also. अब फिर भी cancer हो गया. I mean, why? Kind of. But that is also like we also say, but this is also like there is 5% chances that it can be random also. है ना? Like you never know what kind of mutation happened while you were doing something. Some people they are working like I know recently I have a case. He's a pharma industrial specialist, and he was telling me. So we were trying to narrow down, कि भाई, how did it happen? He has lung cancer. He's only 48 years of age. So he said, I don't smoke, I eat organic food all my life. And no, he's from an elite, rich person. So he said, everything is perfect, kind of that person. So we said, ki, okay, and because I have worked in like pharma production company also. So I know, at least in Germany, I've seen there a lot of, they keep a lot of protection while you're working with toxic chemicals. But I assume and I expect that in India, a lot of these precautions are not taken. है ना? And I asked him, okay, does any of your colleagues also had cancer also? So he told me, yeah, there were one or two people who were working me all the time and they also developed that. So probably then we narrow down ki maybe when you are working in an industry where you are making medicines or the production is happening, maybe something has happened there. So just giving you an example to sort out that how we narrow down about it. If they ask, okay, why did it happen or something like that.
Mm-hmm.
So I hope
Great.
I answered you.
Yeah, so I actually wanted to know, so here since I'm in US, so whenever we even go for a simple treatment, we are given this guidelines, do you smoke? And all
Hmm.
these general questions are always we encounter. So
Right,
just wanted
right.
to know what you did differently because this kind of
Yeah,
questions also come from a hospital setting. So I just wanted to
yeah,
know that.
but yeah, but they are in an abstract way, na. I also started with giving up like forms. So do you smoke and do you drink? But none of the person in my like last 7 years of none of the person said I drink. But when you talk to them, na, they say, yeah, sir, कभी कभी हो जाता है ना, kind of. So that is the difference. How do you approach the thing? Abstract way में आप पूछोगे, do you smoke? They even say नहीं नहीं करते. But when you talk to them and they open up, they are comfortable with you. They would say, sir, I used to smoke when I was a student, and yeah, I quit 5 years back or so. So this is what the difference is.
Mhm.
And also, like, there will be no column to say, okay, have you worked in the pharma industry? Have you worked with toxic chemicals also? Right? So
Mhm.
I think this is the difference what we do, that we talk in person and it's more humanly way rather than, just fill up the form and show it to the doctor. And again, the doctor will have only 5 minutes or 10 minutes for you.
Mm.
And we were normally my session is like until your questions last or like probably 1 hour or so. So this is what we do differently. And I'm
Yogi,
happy to take if anyone has any suggestions to help me out also.
Mhm.
Yogita has a question related to this. Were you trained as a coach?
Not trained, but I did when I did my master's in psychology. So I did my internship in Germany. And at that time, yeah, I had the interaction with the patients and all because I was interested in that how it works and all. So that is how. But yeah, you can say that because I started this work understanding the problem of the people. So I just trained that what is coming and how should I react and how should I answer? How can you narrow down these things? Because I don't see what I do as a cancer health advisor, as I said. I don't think there's a training available to this or there's
Wow.
any course designed to do this. So it's by learning by doing, and so that's
Mhm.
how.
Yeah, I think that's an important point. I think the fact that you did your master's in psychology at least provides you with some kind of a overview of how to deal with these
Right,
situations. But
right, right.
in terms of cancer counseling, there's genetic counseling, and there are courses on genetic
Mhm.
counseling, and
Okay,
that is there in India. And the proper
okay,
genetic, it's a 2 3 year course, and
okay,
it's a very interesting career choice. Uh,
okay,
of I can, if you're interested, I can introduce you to some people like that. I mean, in terms of
okay, sure.
just to I don't do
Mhm.
anything formally like you do in terms of cancer counseling, but
Mhm.
as scientists, many of us on this
Mhm.
group are all scientists. फैमिली में लोग कहते हैं that तुम scientists हो जरा हम cancer, if you know anything about cancer, and they call me, and and so पहले तो I didn't know what to tell.
Mhm.
I try to connect them to as many physicians, doctors, or
Mhm.
professional folks that are involved.
Yeah,
And that is the first thing I'll do instead of trying to
right.
tell people. But then, if they
Mhm.
are persisting that we need somebody, I tell them this story about cancer, which is the
Mhm.
5 steps of cancer that I talk about, which is in the last 100 years, cut,
Mhm.
burn, poison has been the treatment. Then in
Mhm.
2000s, the treatment was targeted therapy, where when the human genome was sequenced, you knew which targets to
Right.
interact. And then in 2010 or so, immunotherapy became popular with
Mhm.
checkpoint inhibitors. And now
Mhm.
it's all combination of all of these factors. And in the future, it's going to become more personalized medicine with even, your specific kind of mutation will result in that particular
Mhm.
treatment. So having said all of that, now in my own life and in my own readings, Amit, maybe we should talk a little bit more about this next time, is
Mhm.
I think all of this kind of cancer research that happens is a sort of reductionist approach of Western science, where you're
Mhm.
looking for that PD-1 molecule, you're looking for that KRAS
Mhm.
mutation or that particular HER2,
Right.
overexpression, and then
Mhm.
you treat the patient and you think you've cured, but then you've not addressed circadian rhythms, you've not addressed the
Mhm.
neurological effects, you've not addressed
Right.
microbiome, you've not addressed anything really.
Mhm. True, absolutely.
Therefore, a holistic approach of cancer is absolutely required for
True.
treatment, which I think
Yeah.
Ayurveda has, but we don't know how
Yes,
to.
yes.
We don't know how to
Exactly. We
map
don't know.
that.
Yeah, true. Absolutely, sir. I completely agree with you. And like just to add on this, I think I missed it during my talk or like so when I started, it was like just answering questions, and then we did lifestyle changes, and then nutrition because there was a person in my group. She turned vegan. She was from Mumbai. She was a very well known fashion designer. She had leukemia and she cured it, and then she went all over India to try yoga and everything, and she adopted vegan lifestyle and all. So we made like it's a holistic thing what we do also. So we have nutritionists in the team. So we connect with them. Okay, if you have any questions about nutrition, it's not that I am doing everything. So we connect specifically if there is somebody we know that yoga can help in that, just to take lifestyle changes and what they do normally. So then we connect to them. So just to add on what you were saying. And
Yeah,
also, like as I said, I'm open to people going for Ayurvedic treatments and all, but to go authentic one or who is not a prankster or something like that.
yeah,
Because there are a lot of those around. Even like medical wala bhi, there are a lot of people who are like pranksters available online. I mean, very famous people, I would say. And if
yeah,
you, I mean, I can name it, but it's like against the policy or something. But like if you go, they check their degrees. They've done like homeopathic medicine in bachelor's, and they are claiming that they're an immunotherapy specialist. There's one in Jaipur, there's one in Delhi, very famous person.
Well, let's not get into the naming names, but I think we all know
Yeah.
that this is a very fine balance. When it comes very easily when you have to give gyan or when you have to talk about it in a abstract way or someone else, but when it happens to your own family, then everything changes. Everything, the whole equation
Yeah,
changes. So let me
you
just
blacked out.
pause here for a few seconds and see if the other folks who have not asked questions yet have any questions.
So I have one question.
Yeah, Sarvesh.
So like you have been in research, then industry, and then now advisory. Like, how was this transition?
Yeah.
And do you ever miss your work in like academic research or industry?
Lab, I don't miss, Sarvesh, to be honest, because I think when I left that in 2019 and I found this consulting, I just loved it. And I said, okay, I'm done with lab. Because when I left the lab, my boss said, okay, my doors are open. You can come back anytime. Because I told him that I want 6 months break. But he said, no, no, you just take a sabbatical and then you again come and join the lab. I said, no, I just want to cut the connection once. Because unless you connect, because in academia, it's like somebody will send you the paper, check it, or somebody will send you the results from the lab. I said, no, I want to cut the connection once. And I think I don't miss the lab, but I keep on reading the new research papers that I love to do about immunotherapy and anything which is coming new on cancer. And now these days, mental health also. Uh, then when I moved to the company, so it's more of a like professional area. There is no human attachment or feelings are not in the company area also. Like when you move to the industry. And my work as a cancer thing or as a counselor, I mean, it was everything is feelings basically. The person
Yeah.
is so sad when they have started talking about their disease or the problems and issues. So it was a big difference. And I was getting really good amount of money when I was working for the industry. And then when you switch off and then you say, okay, now I have to work for people. Again, that's a big slide down. And when you, I mean, more backside is that when you move to India, because people are not ready to pay you. Everybody wants the GAN for free or whatever. So those are the things also like they are challenges for you. But I think if I mean some days I get sad also. Ki, yaar, why? I mean sometimes it's very strange. I will tell you. I will give them three hours of counseling on different months or days about why is happening or is this treatment correct for you also? What can you change in the lifestyle and all? And on the fourth said event, I would say, okay, this is the charges, and they will not reply that. So which is like really, I mean, come on. And they
Yeah.
are well elite people, I would say. Well earned, well nice people. So that is sad sometimes that everybody is just. So yeah, these are the challenges which makes you think, okay, should I go move back to Germany, back to my job or something? But I think then I'd see, okay, even if I could help someone and do something good, so that is a motivation.
Yeah. Yeah. Nirav.
Thank you, sir, for giving this opportunity and thank you for sharing your experience. So, I have this naive question as such. The psychological consultations which are provided to, say, a cancer patient, is there any credible evidence that does help in treating patient in a better way, or it's better than just normal treatment provided? Could you comment on this thing?
Yeah, sure. So if you are thinking that this would be the cure, then no, it's not a cure. It's like understanding the mental situation of the person who, I mean, let's say if there's a 35-year-old person and he goes to a doctor and he says, "Ki, you have cancer and you have maybe 2 years to live or something like that. Just imagine 35 years of age. He got married few years back and he has a young child also. So it's about, and also like if you talk about scientific evidence, if you are mentally strong and in a good headspace, the disease. First of the thing is you have to accept it. Ki, हाँ भाई, ये हो गया. This is what it is. I will go and take the best treatment available. ठीक है ना, in India or abroad if they can afford or whatever, however. But the thing is, once you have clarity about those things and you have mentally strong about it, and that only comes if you talk to a person. I mean, in US and Europe, it's very common to have psychosocial oncologists. This is the term they use for people who are working, helping psychologically to a cancer patient. Unfortunately, in India, it's not so prominent, but yeah, in tier one cities, probably Delhi, Bangalore, Mumbai, they have these people, psycho-oncologists. So basically, it's getting them ready about the things which are coming in their life, about the treatment, what chemotherapy will bring, how hardships it is, what they have to be prepared for, how can they fight better or something, or helping out with any like very basic questions. Abhi, in general, we are also, everyone in this panel, I think, would say that कुछ ना कुछ तो tension life में चल ही रहा होगा ना. ऐसा तो नहीं है, everybody is happy go lucky. So जो चल रहा है, at least उसको light करना उस patient को, making them light, making them comfortable, and making them ready for the things. And there are credible evidences that if you do these things, this is also part of palliative care, that okay, understand the emotional circumstances of the patient. And there are credible evidences that if you take these things, take these measures, obviously that the outcome is better. I mean, there are publications on that. So people who go for psychological counseling or palliative care specifically, the outcomes is very, very significantly better. So if I answered your question, Neerav.
Yes, sir, yes, sir. Like it was insightful. But like, have people also looked into some molecular aspects of this that specifically for cancer? Okay, if we are giving the palliative care, the tumor reduction is happening at much faster rate, or some kind of response which can be quantified as such.
Yes, of course, that's what I'm saying. I mean, they have studied on the basis of survival, not on the basis of tumor volume also. Because anyway, when we say palliative care also, there is a regular treatment which is going on. It can be radiotherapy, it can be chemotherapy or immunotherapy. So it's not that it's a separate field in cancer that only psychological counseling or palliative care is working. No, you are getting the medical treatment, but with that, you are also emotionally open to talk about it or getting the best ideas about palliative care and all that. So, and then you see the survival differences are very significant. But this is not the only thing.
Sure, sir. Thank you very much.
Jagri, do you want to ask a question, or are you just making a comment about stress and autoimmune disease?
Sir, just a comment.
Okay, yeah. All right. Any other question from anyone?
I think I have a question. So Amit, so now we see the I think emergence of AI, and I think now many big companies are bringing in maybe bots to talk to people, right? They are doing coaching or whatever kind of like they're available for people to talk to, right? Because that something is not there. So do you think you will be integrating AI at some point to manage maybe like more people, or how it could be like useful to what you are doing?
At the moment, I would say I'm not confident about a chatbot or a AI to integrate in this work, because I keep posting about these things and I'm also giving like awareness lecture in colleges and all, and I make the slides like that. Okay, you are using ChatGPT these days for counseling or talking about mental health or anything, you know. But then one day I was very curious that all of youngsters were asking this question, and I sat myself and I asked ChatGPT, "See, can you replace a doctor?" And it's absolutely said no. You can try it yourself. Try it on any AI platform. Can you even ask them, can you replace a counselor or a psychologist? They would say no, you can't. And because again, it's very first few days which are going in those business. And recently, I don't know, there was a report in US that one of the person he he became like the chatbot was a female, and he thought or he felt that she is my girlfriend. It's published in New York Times, and he committed suicide because that chatbot said, "Okay, let's meet outside this universe or so." So he committed suicide. So this is how dangerous it can be. And you can't. Right now, it's too early,
Yeah.
right?
No, I think AI is a very complicated topic. There are many, I'm sure we are all looking at AI in our own ways on how to use it and how not to use it. And we can maybe another day we can have a detailed discussion. But we're
Yeah.
coming to the end of the session. So normally, Amit, what we do is we have a rapid fire session, and we ask a bunch of questions. I mean, you can answer them. And I've asked Shruti, who always does this rapid fire for us, and so she's going to do the rapid fire for you and ask you these questions.
So it's such a surprise package for me. Virender ji
Yes.
didn't tell me about it. Okay,
And nothing difficult, I'm sure.
no worries.
All right. So I'll just ask 5 rapid fire
Yeah,
questions and
sure.
maybe reply it quick. Okay. First, what's the most common misconception about cancer that you have come across?
Most common misconception. Vegetables, the pesticides, adding pesticides in vegetable can cause cancer or not, something like that.
Okay.
Yeah.
And what is harder, physical pain or emotional pain when person goes through a cancer?
I think if we handle the emotional pain better, physical pain becomes little easier to handle because mentally then they are strong to go ahead.
Mm-hmm.
I'm
Okay.
keeping it short.
Yeah. Yeah. What is the screening test that everybody should know about?
So there are a lot of blood tests these days, very simple ones. At least in outside India, they are very well available. But there are to start with, there are few tests which are available in India also. But they have to be taken very cautiously because sometimes they are money making.
Okay. What is the
Yeah,
most rewarding part of your work?
very good question. When I'll take a little few minutes to talk. 1 minute maybe.
Yeah, I
So
mean, you
there is
can.
a patient. There is a patient which I have been counseling emotionally for 1 year or so, and she has only few weeks to live now. And she had so much of trauma inside her head. We have healed her in 1 year. Talk about her divorce. When she got divorced, after few months she got detected with cancer, and so a lot of trauma. She was separated from the kids and all. So she was so heavy on the head, and probably the treatment didn't work as good as we expected. So, but then when I talk to her these days, very rarely because she's on bed most of the time. She's only 45 years of age, just for your knowledge. And when I talk to her, she feels so light that, okay, I'm so thankful that I could be connected with you. Even if anything happens, she knows that she doesn't have so many weeks to live or months to live, but she feels I'm very light in my heart and my head. She has forgiven everyone and she's meeting the husband, ex-husband, and the kids properly. So I think that's the thing that at least we all have to go someday, but it's better if we go a little lighter and with a smile. I think
Right.
that's what I try.
Beautiful.
Awesome. That's really good. Okay. And if there is one thing that you could change in cancer care, what it would be?
So bringing the palliative care like in sync with the medical treatment. So it is, at least in good tier one cities, it is there, but still it is kind of little neglected.
All right. Yeah, that's
Yeah,
it.
thank you.
Thank you so much for your response. It was really insightful.
Yeah,
Thank you.
wonderful,
Thank you.
wonderful. I'll just ask generally two more because I like 7 questions. So I'll ask. Amit, so who are your people who you are inspired by?
So I get inspired by people who are ready to go like an extra mile um, without any without any expectation, I would say.
Hmm, hmm,
Just take that leap forward. I mean, it can be anyone like Sachin Tendulkar also, or you can say Virat, or Amitabh Bachchan. I mean, big people, or all even Rahul Dravid or Ratan Tata, or people who are just there to just go on that path. And because sometimes we don't know whether we will be successful or not. So we
Mm.
just move on it, and at least if we will learn something, even if we fail.
And then one maybe final word is, for these students or people who are in our group, any advice that you have, either professionally or the field that you're working on, or anything that you want to say?
Yeah, I'll just share my experience. So just do it very honestly what you are doing. Even if you're working for a company and you know that they are shrewd and they are using you or something, you do your work with full honesty. And when you do it with full honesty, you learn a lot. And nobody can take that from you, to be honest. Anywhere. If I look back, I always thought that since my master's only, since I got interested in research, I did it with full honesty and full dedication, and for anything. So just do it, and just leave it on the universe or power or whatever available, and it will come back to you. So
Yeah.
one of my lesson, some of the patients also they ask, and I say, keep doing good. Like karma it will come back definitely. So I think that's it.
Wow. Beautifully said. So thank you so much. This has been an amazing session, and thank you, Amit, for spending some time with us, and all of you to join. Thank you so much. If all of you have a
I'm
minute,
so
if you
happy
can
to
put
be
your
here.
videos, maybe Amit can see all of you, if possible.
So thank you for bringing me here. Thanks to Vijender ji, Charu, who is not here, and Naren sir. So it's really glad I could be here and talk to you guys. And yeah, sharing what I have here. So
Yeah.
really, really thank you. And